Hi everyone, I'm Dr. Shruti Jain, working as a stroke specialist with Jaipur Golden Hospital, New Delhi. As we all know, stroke is a neurological condition with long-term disabilities and serious complications which results from loss of brain function. Timely intervention to halt the disease process, either in infarct or hemorrhage, is a must for managing the patient with acute stroke. For this, the hospital providing the basic and further intensive care to the stroke patients should satisfy certain requirements. I will put some light on the requirements a hospital must satisfy to be recognized as a stroke center or a stroke-ready hospital. We all know there is a narrow window period of 4.5 hours to initiate the clot-busting therapy in eligible patients with acute brain ischemia, and sooner the treatment is started, better will be the outcome. For this, first and foremost, the hospital should be easily accessible to the patient in terms of time taken to reach the emergency room. The emergency room of the patient should have an intensivist or a neurologist who can quickly identify a stroke patient. The nursing staff of the hospital should be trained for the assessment of patients and grade the disability using the standard NIHSS stroke scale. The emergency room should ideally have point-of-care blood tests for estimating the blood sugar levels, coagulation profile of the patient, and other specific investigations as per the case history. After the initial contact in the emergency room, the hospital should have a facility for the CT scan to classify a stroke into ischemic or hemorrhagic variety. Since time is crucial, the process of getting a CT scan done and read at the earliest is essential. Hence, the hospital should have the radiology department working round the clock. The hospital should have facilities to ensure a quick transit of the patient from emergency to radiology department and from radiology back to emergency or ICU, wheresoever clot-buster therapy is to be given. Then the treatment starts, which begins with clot-busting therapy in eligible patients. Thus, the hospital must have a fully functioning ICU with personnel efficient in handling and managing the patients. That's all from my side. Remember, if you see a stroke patient, you must rush the patient to the nearby stroke center, call the ambulance, and ensure a favorable outcome for the patient. Thank you.